Hi, everyone, and welcome back to Birth and Beyond. My name is Adrianne, for those of you who don't know. So, this week's the topic of this week's video was inspired by an article that was sent to me by a really good friend of mine. And the article was written on phillyvoice.com, and the name of the article was Dear OB, It's Not Your Vagina. So, I love this article because it was super empowering for pregnant and laboring women regarding consent that your care provider has to get from you before they do any procedure or offer any type of anything, right? Like, you have the right to ask questions about any procedures that they want to do to you. You have the right to refuse vaginal exams. And I think it was super important for this article to explain it like this because I think vaginal exams is something that is very common and they are valuable. I will say exams are valuable, but they are not mandatory and they should not be forced upon any woman who decides that she does not want to have one. So, real quick, this article highlighted two scenarios. The first scenario, there was a woman in labor and she was getting care from her provider and a nurse. And the article talked about how the way in which her labor was progressing was being communicated to her using terms like your contractions aren't working and your labor is slow. So for this woman, she was kind of like nervous and in her head kind of and concerned about like, well, like what's going on. But at the same time, she didn't want to have a vaginal exam because the provider was letting her know that I need to do an exam on you, and the woman's like, "Ew, I don't really feel comfortable with that. They hurt." But at the same time, she's nervous because she's like, well, you're telling me that something's wrong with my labor, something is wrong with me. So I guess I have to submit to this, right? And so in the end, the care provider ended up giving her a vaginal exam. And when he was done, he said, okay, they're all done. I've stripped your membranes. And she's like, you did what? You stripped my membranes. Like, I had no idea that's what you were going to do. You didn't explain it to me. All I know is that I just had the most painful vaginal exam ever. And for those of you who may not be aware, stripping your membranes is a procedure that is done. It can be done in your doctor's office by an OB or a midwife, and it's basically a manual way to induce labor. And what your care provider will do is insert their two fingers into your vagina like a normal vaginal exam, and they strip your amniotic sac. They separate it from your uterus. The amniotic sac is the bag of water that your baby is sitting in during pregnancy, and they detach that from the uterus, and doing that releases hormones that spur on labor, right? And so that's what he did, right? And so that was the first scenario, and it was just like clearly there was like a lack of communication. There was no informed consent given to this woman. It was just something that just happened to her. They did this to her, and it was against her will. And the article talks about how this happens to many women, and some women walk away from their laboring experience feeling like they've just been sexually assaulted, and that's very, very tragic. And so the second scenario in this article highlighted a woman who was about 41 weeks gestation or 41 weeks pregnant, and her midwife was concerned just because she was past the 40-week mark, but her midwife had a conversation with her, letting her know that she wanted her to consider a manual induction, and explaining to her why because of the practice and where she worked, she would not be able to go past 42 weeks. And she also included the woman in the conversation, finding out from her, well, what are some things that you've been doing to induce your labor or to bring labor on naturally? And then she went on to give her suggestions of things she can do at home to bring on labor. And she just clearly explained what the stripping of the membranes was, what's the steps that she was going to take if she decided to accept the stripping of the membranes, and just basically explained to her her options. Like, she helped her to make an informed decision. Although this mom was still afraid and nervous about the pain involved, she gave her information to allow her to make an informed decision. So in the end, the midwife ended up stripping her membranes, but literally walked her through step by step what was happening. So the mom was a lot more comfortable and felt respected throughout that whole process. So like, this article just was super, super awesome. The link is below. Read it when you get some time. And it also, I loved, explained that in fact, vaginal checks are not mandatory. And I think that is something that appears to be mandatory because it's so common during pregnancy and labor, especially if you are getting your care in a hospital setting. But it's actually not mandatory. And I want everyone, all of you out there, to remember that you have the right to ask questions of your care provider. You have the right to refuse a vaginal exam just as much as you have the right to request a vaginal exam. I don't want to give the impression that vaginal exams are not good and not valuable, because they are. They are very beneficial and they serve a purpose, but they should never be forced and they should never be given to you without your consent. And as a side note, before I end, there are other ways for your care providers to assess the progression of your labor without checking you too frequently. One being looking at the change in your contraction pattern. So, how long they're lasting, how far apart they are. Also, just visually assessing you with how you're coping. Earlier on in pregnancy, you're a lot more alert, you're talkative, you're having contractions, but you're able to um, just just conduct yourself in a more controlled way. And when you start to progress into 4 centimeters and on, like 4 to 7 centimeters and 7 centimeters and beyond, or to 10, you are a lot more, you might not talk as much. You're a lot more concentrated. You may be moaning. They say if you throw up during your labor, that's a great sign, because it shows that you're transitioning and your baby will be here really soon. If you have a bloody show, um, if you're shaking or moaning, all these different examples are things that care providers can use to assess the progression of your labor, other than checking you vaginally. So, to answer the question of this week's video, do I have to have a vaginal exam during pregnancy and labor? The answer is no, you do not. Again, they're valuable and serve a purpose and have their place, but know that you have the right to refuse it, and you have the right to ask questions of your care provider about why they feel you need one. And you also have the right to request them if you do want them. All right. So I'll see you guys next time. Thank you so much for watching. And as always, I welcome your questions. And I'll talk to you guys next time. Bye.